Every day, scientists, physicians, and engineers are working to ensure that medicine develops and provides as many treatment options as possible for patients. The goal is to reach the point where all diseases can be cured, even those considered incurable or unknown today. The medicine of the future will be different in that it will focus on treating each client individually and will move away from a one-size-fits-all approach. Timely diagnosis. We all know the fatal importance of a timely and correct diagnosis. After all, any disease is much easier to identify in its early stages. Most of the time, we go to the doctor when health problems become obvious. Imagine if doctors knew ahead of time the dangers of certain diseases and could monitor the patient's condition remotely. This could be done through medical applications on a smartphone, various sensors that would be embedded in watches, clothing, or bracelets. These devices will monitor important body indicators: heart rate, body temperature, oxygen saturation, systolic and blood pressure, physical activity, sleep, and so on. All data will be available to the doctor, so in case of deviations from the norm, we will be able to hospitalize the patient as quickly as possible or to prescribe additional tests. This will be a new page in medicine. The doctor will not be familiar with the current symptoms, but with the dynamics over the months. Patients will also notice their deteriorating condition more quickly and react in time. Printed organs. The future will definitely see the active development of medical 3D printing in the biotechnology industry, which has turned the world of pharmaceuticals and donor organs upside down. 3D printed arteries, bones, and livers are already being actively used. The main importance here is the amazing results of transplanting such organs. After all, when creating new tissues, the patient's genetic map is used. Therefore, with a successful transplant, the risk of rejection is minimal. These organs are also capable of developing blood vessels and capillaries. Scientists are now working on creating an artificial kidney. It will soon be possible to print any organ. The results of using 3D printers in pharmaceuticals are also impressive. Soon, patients will be prepared with printing the drugs according to a model that was individually prepared by the attending physician. Individual selection of drugs. Doctors know many cases when the same drugs have very different effects on different people. Until recently, it was the only way to find out how medicine was to study it. On a patient. Fortunately, old methods are changing. There is an active development in the field of pharmacogenomics, which studies the influence of genetic factors on the body's response to a drug. In other words, before prescribing the right drugs and their dosage, this approach will be much more effective with significantly reduced side effects and even a partial reduction in the price of the drugs. Today, this method is already used during the treatment of AIDS and some types of cancer. Pharmacogenomics is developing quite quickly, and it is hoped that soon the list of diseases that will be treated by this method will increase significantly. Artificial intelligence. Even today, artificial intelligence is one of the most in-demand technologies in medicine. It is both an opportunity to increase the accuracy of tests and practically a personal medical assistant in a smartphone. These days, AI can diagnose eye disease, cardiovascular disease, and cancer just as well as professionals. It is expected that technology will soon be able to do 80% of a doctor's work. Imagine the situation. You are sick and you go to the doctor. After the doctor listens to all your symptoms and enters them into the computer, a special program will compare your results with millions of similar cases and select the most effective treatment. It will also be possible to analyze X-rays and MRI data and understand the cause, because there is always the possibility that a person may simply not see it, since his experience of comparison is much less. Already now we can talk about a significant breakthrough thanks to AI in dermatology. The work of doctors has become much easier thanks to the fact that AI creates a dermatological passport that records and describes all families and formations on the human body. In this way, there is observation and detection of any changes in the early stages. Previously, similar processes recorded a lot of time. After all, there are about 100 types of formations that require observation. Plus, it was necessary to save and compare this data. Now these functions are perfectly performed by AI. It takes photos of the education, compares these photos with the patient's past studies, recognizes their types, informs about changes, and reports about dangerous and suspicious trends. In addition, all these indicators can be combined into huge databases. This is critical because today it's very problematic to involve large numbers of patients in the process of regular research. The analysis of all the data will lead to the search for effective treatments and new discoveries. It is wrong to assume that AI will replace doctors. This kind of technology is not trying to exclude the physician from the treatment process, but to help him to pay attention to some combinations of circumstances that he might not have noticed without the help of the system. Future dentistry. Nowadays, it's very common for different doctors to have a different treatment plan for the same patient's problem. Here, of course, much depends on the level of the dentist, experience, and education. In the future, it will be enough to take a picture or an X-ray and upload it to the cloud. The program will then be able to make an accurate diagnosis and outline an approximate treatment plan. Depending on the location and budget, the AI will choose the right dentist. By the way, this will significantly improve communication between the doctor and the patient. It will create a certain safe atmosphere. After all, now it will be simple to do your job, to treat people, and not to sell something or fight your way through the patient's fear of a doctor due to a negative experience with doctors. The discovery of 3D printing and 3D scanning can also be a revolution in dentistry. For example, until recently, long and painful operations such as dentures or braces were performed to straighten teeth and correct tastes. Today, these are replaced by e-liners, a customized program that uses transparent retainers that cause minimal discomfort. 3D printers have begun printing plastic temporary crowns or even removable dentures in multiple colors from available materials. Cyborgs. Simultaneously with organ printing, scientists are working on the creation of cyborgs. Today, millions of people are carrying implanted defibrillators and pacemakers, robotic limbs connected to a nervous network, yet the potential of this field is much greater than just replacement. In the future, this industry will focus not only on correcting organ deficiencies, but also on creating new, more perfect ones. For example, what about the idea of getting lungs that can breathe underwater, enhanced muscles, or vision in all spectra? A treatment based on human DNA. Scientists began deciphering the human genome 30 years ago, but the breakthrough came after the use of AI. Now the work is almost at an end. Many functions of genes have already been unraveled. This means that soon we'll have a personalized medicine with individual therapy for each patient. Operations of the future. Thanks to the new technology, unique opportunities will open up for doctors. For example, a surgeon will use goggles during surgery in which he will be able to see all the blood vessels, the structure, and density of tissues. Conversely, he'll be able to use a surgical knife, which will work like a Jedi light sword. With an electric current, incisions can be made with minimal blood loss. Even regular contact lenses will be able to measure a patient's sugar levels. Hey, thanks for watching, and we'll see you soon.